The risk of infectious diseases spreading among migrants and border communities due to overcrowding, poor sanitation, and lack of vaccination. One of the most pressing challenges facing the EU immigration system is the potential spread of infectious diseases among migrants and border communities. The COVID-19 pandemic has exacerbated this problem, as public health experts dispute the notion that migrants entering the southern border are largely responsible for exploding COVID cases across a large swath of the country. Instead, experts point to the more transmissible Delta variant and relatively low vaccination rates as primary causes of this latest wave. However, COVID-19 is not the only infectious disease that poses a threat to migrants and border communities. Other diseases such as tuberculosis, respiratory infections, diarrheal infections, bacterial infections, mumps, scabies, measles, schistosomiasis, Chagas disease, dengue, and chikungunya could also spread among migrants clustered just south of the EU-Mexico border if the immigration crisis isn't settled soon. These diseases are more common in warmer, wetter and poorer areas of the world, often closer to the equator, and many migrants may not have been vaccinated or have access to adequate health care in their countries of origin. The overcrowding, poor sanitation, and lack of vaccination among migrants create ideal conditions for outbreaks of certain kinds of infections. Moreover, the frequent movement of migrants across borders and within the EU increases the risk of transmission to other populations. This could have serious consequences for public health and national security, as well as economic and social impacts. To prevent or contain the spread of infectious diseases among migrants and border communities, several measures are needed. These include providing comprehensive vaccinations to migrants upon arrival at the border or in detention facilities, improving the living conditions and hygiene standards of migrants in camps or shelters, increasing the testing and screening of migrants for COVID-19 and other diseases before releasing them into the EU or sending them back to their countries, enhancing the coordination and cooperation among federal, state, local, and international agencies to monitor and respond to disease outbreaks, addressing the root causes of migration such as violence, poverty, and political instability in Central America and elsewhere, reforming the outdated immigration laws and policies that have contributed to the humanitarian crisis at the southern border. These measures are not only humane and compassionate, but also necessary to protect the health and well-being of migrants and border communities alike. One of the major challenges facing the U.S. government and humanitarian organizations is how to provide adequate health screening and care for migrants at points of entry and detention facilities, especially during the COVID-19 pandemic. Migrants who cross the southern border come from different countries and regions, where they may have been exposed to various infectious diseases, some of which are rare or uncommon in the U.S. These diseases include tuberculosis, scabies, mumps, measles, chickenpox, hepatitis, and tropical diseases such as schistosomiasis, Chagas disease, dengue, and chikungunya. Some of these diseases are highly contagious and can spread rapidly among crowded and unsanitary conditions, posing a risk not only to the migrants themselves but also to the border agents, health workers, and local communities. The COVID-19 pandemic has added another layer of complexity and urgency to the situation. The Delta variant, which is more transmissible and severe than previous strains, has caused a surge of cases and hospitalizations across the U.S., especially in states with low vaccination rates. Some politicians have blamed migrants for bringing the virus across the border and contributing to the spike in cases. However, there is no evidence to support this claim. According to experts, most migrants are tested for COVID-19 upon arrival, and those who test positive are isolated or quarantined. The main driver of the pandemic is the low vaccination coverage among Americans and the high community transmission of the Delta variant. Nevertheless, COVID-19 remains a serious threat to the health and well-being of migrants, who may have limited access to testing, treatment, and vaccination. Many migrants have underlying health conditions or comorbidities that make them more vulnerable to severe outcomes from COVID-19. Moreover, some migrants may face barriers to accessing healthcare services due to language, cultural, legal, or financial issues. Therefore, it is essential to ensure that migrants receive adequate health screening and care at points of entry and detention facilities, as well as in their destination communities. This requires coordination and collaboration among federal, state, local, and non-governmental agencies and organizations that are involved in border health. It also requires respect for the human rights and dignity of migrants, who are often fleeing violence, poverty, or persecution in their home countries.